Okay, so the first one is to release the fascia. Remember I was talking about the different fascia components within the skull itself? So we want to open up, so we got the falx cerebri and the tatorium cerebellum. So we're going to work on the tatorium cerebellum first. So what it is it's what we call a common hold, okay? So I have my thumb on the phenoid bone right now. Again, thumb on the phenoid bone, okay? Next one, I'm going to put it right on the OM suture, and then my fingers are going to come around, okay? Index finger on the OM suture, and then my fingers are going to come around, okay? So it's kind of going to look like this, okay? Again, phenoid bone, OM, and come in through here. And what we're going to do is the thumb is going to shift right and left. My under fingers are just there as steady. They're not putting any pressure. We're letting the gravity of the head sink in. But what I'm doing, again, is trying to move the fascia within the brain left and right by shifting that phenoid bone back and forth. And there's not much force. I'm just lightly, this is like millimeters. This is just very gentle. It's not like, okay, I'm going to do a trigger point in the head. You will give the client a headache, okay? So it's just you're very gently cupping in, grabbing the bone, and we're gonna shift. With Kim, you can actually see I go this way. She doesn't want to go this way. She wants to go this way. So I'm gonna take her the direction she wants to go. So I'm shifting everything over to the right side. And then I'm gonna hold there, and then I'm gonna shift it back. Now she's going. Again, I'm gonna shift the cranial bone back and through there. So again, we're loosening up that fascia between the two bones. So we're getting back and forth. Okay, so that's for the tatorium. Okay, now we're gonna balance the suboccipital. Okay, so now we're actually gonna come underneath. One hand underneath here, other hand on top. You can do on top, you can do another hand on the side, or you can do both hands under. I like to have my control hand here, this hand here, and what I'm doing is I'm pulling back on the suboccipitals, so I'm tractioning underneath. This is just a support hand. So I'm just doing a support hand under here to release the cranial pressure. Again, if they've had a concussion, so with Kim, we can see she likes to go here, she's stuck. So I need to get that one bone freed up. So I'm gonna free up, pull back, traction, hold. Again, push in, traction again, add a little bit of overpressure. Again, traction again. Again, this is just guide. There's no force through my upper hand. It's just my lower hand is holding the pressure in. And then I'm gonna recheck again. And there we go. We got flexion back in through this area, okay? So we got now the movement back in, okay? So that one is suboccipitals. Now we can come in through the sacrum. Tess, you mind moving that, okay? So if this is my client, okay, I'm having one hand underneath, grabbing the sacrum like this, okay? So we're holding the sacrum like this. We're squeezing the two SIs together, and then my other hand is gonna slide underneath, okay? So it's gonna look like this, okay? So this one is squeezing SIs, this one's coming underneath the tailbone, okay? So if this is my patient, I'm gonna slide under, grab on the two SIs. You can either come through the legs. I like to come through the side. It just doesn't feel as invasive with the patient. And I'm squeezing the two SI joints together while my bottom hand is tractioning back, okay? So I'm tractioning back on my bottom hand. Like I said, we're trying to get the occiput and the sacrum together. That's why we did the occiput first with the suboccipital release we just did, because again, the occiput and the sacrum both look the same. So what we're trying to do is get the two bones, because when the fluid moves up and down, it's like a wave. So I try to move my body the way the wave feels. Right now, her wave is very fast. You can see my body's moving really quickly. The more I traction on it, the slower it'll start to go. So now this is the pace of her wave. And that was because she was in fight or flight before.
I didn't feel that one.
There we go. Release. Now I can come through the same thing, so now I can have bottom hand here and other hand on the occiput. And then I'm doing both hands separating together now. So basically both my hands are underneath like this. So this is my spine, occiput, sacrum, okay? Okay, so this is what's happening right now. And I'm pulling one hand up and then one hand down. So it's, again, that sacral rocking back on the area. Again, so if this is my patient here, I'm rocking back and forth to try to get that balance back. Okay, so again, on Kim here, on Kim here. And I'm gonna occiput and then sacrum. And occiput, this is the wave of the fluid that I'm feeling. The hardest part is to pick up the cranial fluid because people get it mixed up with the respiratory rhythm all the time. But what I'm feeling is the sacrum going into flexion, then the occiput going into flexion, and then the sacrum's going into flexion, and then the occiput is going to flexion.
Are you going with it or are you trying to affect it?
I'm going with it and I'm adding a bit of a pull when I'm going here, and then I'm adding a bit of pull to traction it.
So is it slowing on its own?
It's slowing down on its own. I'm affecting it. So this is a direct impact affection because her cranial rhythm's fast. Because of having the concussion, she's in fight or flight response right now, okay? And then we're gonna go after that. Let's skip that one. Okay, this is a cervical pump. Okay, so we're just coming underneath the head here and we're lifting up. The head does not lift the ground. Okay, this is a craniosacral technique. Okay, so basically I'm grabbing my fingers and I'm doing this motion. Okay, what this is gonna do is get that excess fluid. You can either do it the opposite way where you're coming through. Okay, we're just trying to promote the fluid. So I'm picking the fluid up and then I'm pushing the fluid back down towards the heart. Picking the fluid up and then back down through the heart. Okay. And then the last one is called a thumb pump. So I'm getting my two hands on each side of the parietal bone. And what I'm gonna do is this motion. And the whole body should move when I'm doing this. You can see she wants to move a bit on her toes, but she's not really moving all the way through. So if I do it more, there you can see as I'm getting it and as I'm doing this, we're getting the fluid all the way down to her feet. Now her feet is moving, where when I first started, it wasn't moving, okay? So this is getting each fluid in each of the vertebrae. So what I'm doing is I'm compressing every single one of these discs all the way down the toe to open and close, open and close, open and close. Like I said, this whole spine should move when they're moving. So we're trying to get that whole movement. And how did that feel, Kim? Not too bad?
Great, yeah.
It's very calming. Most clients will fall asleep. Brad will probably fall asleep right away 100% when you do it on him. But those are the 5 techniques. I'll get you guys to hop on the table through and we'll walk you guys through that right now, okay? Yeah.